you from like struggling with fear when you're pushing. So I call this the emotional preparation piece. And this is super important to focus on as you're preparing to bring your baby into the world, to like focus on your own relationship to your body, to your fear, to how you feel the experience is going to go and what's coming up for you. Because when we feel fear in the presence of the sensation of pushing our baby out, that can cause us to either tighten our pelvic floor in the presence of that pressure. And when we tighten our pelvic floor, it can prolong the pushing phase. And a prolonged pushing phase, based on the research that we have, is one of the top risk factors for tearing. And a very fast pushing phase is also one of the risk factors for tearing. So sometimes people will feel the pressure and they'll want to get it over with quickly because they're so emotionally overwhelmed about it. Because when they add extra force, they can like get the baby out faster. And that happened with my first birth. I was just like really overwhelmed about all that pressure, and I didn't feel emotionally prepared, and I was afraid of tearing. And so in the presence of that pressure, I was like, I'm gonna tear. And I just totally like freaked out. I was like, I'm gonna tear. And so I just engaged my diaphragm, engaged my tummy muscles, in addition to my uterus contracting to push her out. And she came out super fast, and I really believe that that's why I tore. And with my second and my third births, when the baby, I told my husband to tell me to go slow when the baby's head was crowning. So when like the head came fully to crown, I said, I'm crowning, or he's crowning, and my husband said, go slow. And I was like, oh, thank you, because I totally would have been like, I'm ready to get this baby out. I totally would have added that extra force, because it can feel hard to hold that sensation for a while. And some people experience pain when they have the baby coming to crown, and that can be another reason why they want to push more, because the experience of pain is overwhelming emotionally. Other people don't experience pain when the baby is coming out. Some people actually experience orgasms. They experience pleasure when the baby is coming out, because the baby puts pressure on pleasure points inside the vagina, and that can cause feelings of pleasure, and that can lead to orgasms. So that is also a possibility. So the first thing I like to share when it comes to the sensations and our relationship to sensations in our body, birth and pushing is not inherently painful. It is sensational. And when we can view birth and the experience of pushing as a spectrum of sensation rather than an experience that is inherently painful, because that's what we've all been taught, we're able to then open up to the possibility that birth is not painful. When we are experiencing an intense sensation and we're looking for pain, we will find pain. But when we're experiencing an intense sensation and we feel confident within ourselves and we feel supported and we know that the sensation is temporary, and we're willing to, with each sensation, accept what is, be present with what is, and surrender to it, and then let it pass, and then let a new one come and let that change, because every sensation feels different, especially in the pushing phase when the baby is really coming through the pelvis. That approach allows us to experience something that might actually not be painful. With my first birth, I did not experience pain during active labor at all. During pushing, I experienced pain because I was afraid. And I really believe that's why the pain came. With my second birth, I experienced more pain during contractions, during active labor, but pushing, I had no pain at all. It actually felt great. I didn't feel pleasure, but I felt empowered, and I felt like the pressure of his head coming down wasn't painful at all. It just felt like pressure. But there was no emotional charge to that pressure. I was like, ready to get him out. It's like, ready to meet my baby, but I wasn't emotionally struggling at the same time as experiencing those sensations. So let's talk about a couple tools that you can use to help you work with fear. There are more tools you can find in Module 1 of the birth course, but some of my favorite that I want to talk about today is to first feel your fear. So if at any point throughout the rest of your pregnancy experience, if you feel the sensation of fear coming up within you, instead of resisting the fear, embrace the fear and to just say, I'm afraid. And this can feel really backwards, because a lot of us are used to being in resistance with uncomfortable emotions that come up for us. But when we choose to resist, we end up creating our own experience of suffering and of inner conflict, because the fear is not going to go away by resisting it or by ignoring it, but it will become worse, and it can like grow and bubble up, and then it can kind of come up in non-ideal times. And so simply by choosing to say, I'm afraid, and just allow yourself to feel that fear in the moment, all of a sudden, all that power we were giving the fear returns to us, because it's no longer something that we are struggling with or we're in inner conflict with because we're resisting it. Instead, we've accepted that we have fear and that we're human. And one thing that you can share with your partner that is really lovely is to work on creating your relationship as a sacred sanctuary together, where you can go to them with anything that comes up for you, even if it feels shameful or embarrassing or really overwhelming, like whatever it is. If you go to them and you simply just share from your awareness, I'm witnessing within myself that I'm feeling a lot of fear come up about this thing, about pushing or birth or whatever it is. And if your partner can love you and allow you to feel that fear, that can be a really supportive way to deepen your emotional intimacy as you prepare for birth. And I truly believe that birth is not meant to drive a wedge between partners. It is meant to bring you and your partner closer together and to deepen your intimacy, because your baby is an expression of your love and your connection, and your birth is a celebration of life and an initiation for your entire family into a new phase of life. It is sacred. And so this whole idea that, you go to the hospital and all these things happen to you and you're totally powerless, and someone else delivers your baby and tells you what to do, and the partner is passing out in the corner, and then you guys don't have sex for a year and no one ever sleeps. All that shit, that's bullshit. None of it is actually true. That's a choice. Like, if you want to choose to experience that and follow that path, you're welcome to. It's not fun. And most people don't enjoy that. But they believe that that is the only way, because we're told that that is the way that we give birth in the West. And that's actually just a narrative that was written by men in the early 1900s who wanted to profit off of women giving birth. And the only way to get women to pay a lot of money for birth is to teach them somehow that their body is broken and they need something outside of themselves to give birth. And then we collectively as a culture have chosen to continue this narrative, even though it just couldn't be farther from the truth. And you deserve better than that. So right now, I invite you to deepen your connection with yourself, your own inner awareness around what it is you want to experience for the delivery and the emergence of your baby, and to really honor that, and to be willing to love yourself throughout this journey of preparing to bring your baby into the world, because you're a human, you're not perfect, and there is going to be fear that comes up. There is going to be uncomfortable emotions that come up, and that's normal. And so when we can be present with what it is that's coming up for us by just saying, I feel afraid, and then to hold ourselves, this is like step 2, to hold ourselves in the container of love as we are feeling what it is that is coming up for us. And that is what can really help us move through the fear. And so how to do this, whether you do it with your partner or you do it on your own, is to feel the fear, and then with your attention, put your attention on something else that helps you feel so totally loved. So like if your grandmother, just like someone who really loves you, or your partner, think of someone who, when you're in the presence of that person, you just feel this infinite, total love and acceptance for who you are. And we can't control what comes up for us because we're humans, but we can control where we put our attention. And so if you can feel your fear and just choose to fully put all of your attention on the fear for a moment, like for a few breaths, and just say, I'm afraid, and I just feel that fear in my body. I feel like my throat closing up, all the sensations. And then put your attention fully on someone who loves you, so you can feel that experience in your body of loving yourself. and fully feel that for a few moments. And then put your attention back on the fear. And you can do that back and forth for a little while. And after each time you come back to that feeling of fear, usually it starts to lighten up and become less and less and less until it goes away. And maybe something else comes up later, and that's okay too. This is about choosing to love yourself and accept that you're a human, as you go on this journey of preparing to bring your baby into the world. And really the first step is to drop that resistance and to not wrestle, with the fear that's coming up. So maybe I'll share a little bit more about working with fear, and then we'll go on to the next step. So there's one other tool that you can use, and this is to be aware of all the different parts within you. So I don't know if you've heard of IFS, it's called internal family systems. It's like a way of therapy that I really love. I think it's great. I did a lot of internal work with it throughout my pregnancies, and it was so helpful. So the idea is we're all made of many different parts. And sometimes we might have something come up that can trigger a part from the past, like a part of you as a child, at one point you felt like you were out of control. And so you created a pathway to guard yourself because you don't want to ever experience being out of control again, because that doesn't feel safe. And so this is important to be aware of, because when we go into birth, we are experiencing vulnerability, and to some degree we are out of control. We have a lot of control around who we, the preparation we do and the people we invite into our space and the container that we choose. And then at one level, at a certain point, we need to release that control and surrender to our body and to the unfoldment of birth. And that piece can be really challenging for a lot of people. And that is what made my third birth so challenging. I thought I had it all figured out, you guys. I don't. I really did. I was like, I don't have to do the tools that I teach. I was really just so committed to my own denial of my fear of being out of control. And my birth was a lot more challenging because of all this emotional stuff that came up about being vulnerable and being out of control. And I see this happen for a lot of women as they prepare for birth, women who want to plan everything and want things to happen a certain way. And that's great. And you can do that. Please do that. But we need to also accept that there is a certain degree to which we need to release control and surrender to the experience our body is having. Birth can be intense in the way that our body is having an intense experience that we cannot escape from. And the only way out is through. And, that doesn't mean that you can't use pain medication or anything like that. That is one way to cope, but you still are going through birth, no matter what, when it starts, baby's going to come. And so it's this level that we need to reach where we can really truly surrender to that experience and let it unfold and be present with ourselves, and to cope and make choices in whatever way is most helpful to support us in being able to get to the other side when we have our baby. So going back to IFS, if you notice within yourself at any point as you prepare to bring your baby into the world that there's a part of you that feels like, ooh, I'm not loving this idea of being out of control. I feel guarded, or I feel overwhelmed or anxious. I invite you to sit with that and explore less of, instead of being accepting how you feel and loving yourself as we talked about before. This time I invite you to share an inner dialogue with that part of yourself, and to see if you can get any more information from within yourself about what it is that is coming up for you, and where that part is coming from. You can sometimes identify oh, this is a part of me that is 5 years old, or she's 10 years old and she's feeling really overwhelmed right now. And so if you can pinpoint any part of yourself, even if you can't come up with a lot of detail, but you can, feel that there's this part of yourself that's having a big reaction, you can say, I see that you're feeling really overwhelmed right now. And it's okay to feel overwhelmed. I love you. I love you. And to just hold that part of yourself within yourself, and to give her the love that she probably didn't receive at that moment of life when she was having that challenging experience, and to give that to her now, and to validate her and give her full permission to have the experience that she's having, and to feel those feelings. And oftentimes when we embrace ourselves with love and we allow ourselves to feel those feelings, we no longer are struggling with that anymore, because we're able to process through the emotions that needed to happen. I noticed I teach in-person classes, and one of the moms came to the class, and her husband were in a little bit of conflict, and she was like really frantically upset about what to do with their dog for their home birth. And the dog like can bark in the backyard at the other dog. And she was like, this is really stressful. I don't want that to happen during my birth. What we realized after we unpacked a little bit is that she's just so afraid of being out of control. So unconsciously, she was projecting this fear of being out of control onto all these little logistical things, and then going to her man and like projecting this like, blah, like I'm freaking out about all these logistical things, because she just didn't have that awareness. And I'm so the same personality. But what we were able to understand for her is that there was just this part of her that was afraid of being out of control, that needed to be validated and needed to be loved. And so as a partner, something that you can do is to recognize that there is probably a part of her that is showing up right now that is being triggered in the presence of preparing to go through an intense experience. And to maybe invite her to look deeper within herself and to just love her and support her as she does that work. Like, do you think this is really about the dog? Or do you feel like maybe there's something deeper that's coming up for you? And just invite her to do that exploration, and then just to love her as she does that exploration. And sometimes, you might be super committed to your story about the dog, and that's okay. But you also might be like, oh, you know what? It's actually not about the dog. I'm just like really scared of this thing, and I want to make it about the dog. And that sometimes can be so sweet and supportive to your intimacy, because then you can embrace and hold each other and being like, yeah, like I really validate that for you. It's okay to feel that way, and to just let her feel that way. This is about validating and about loving ourselves and allowing whatever it is that's coming up for us to be valid. And then through that approach, we can move through it. Fear and challenges and all these emotional things that come up for us are not, like I said before, really within our control, but we always have the choice on how we respond and where we put our attention. And often, if we're willing to, when we have more awareness around our own inner landscape and what's coming up for us, we're able to find like what the source of what it is that's happening. And that can prevent us from just getting stuck in a story that isn't really helping or serving anyone or serving our process, and to just like go straight into like, oh, this is what it is. And if that mama, had some of these tools and maybe we're working on them for a while, at that point, she might have been able to be like, oh, wow, I'm noticing within myself this thing about the dog. And instead of going to her man and being like, the dogs, she could have gone to her man and been like, honey, like I'm noticing that I'm really wanting to freak out about the dogs, but actually I think I'm feeling this way, and I really feel like I need to be loved right now. And then he'll be like, you're a goddess, I love you. And you know what I mean? So those are my two tips. And I invite you to just get started on working with those tools. And if you want more support with emotional preparation, our weekly Q&A calls, I can guide you through more things. And then there's also the emotional preparation module 1 of the course, and there's guided meditations and lots more fun things that you can look at in there. Step 2 is provider hands off. So this is a more practical way to help your baby deliver in a way that can prevent tearing. So as I mentioned before, this whole directed pushing narrative is total bullshit. That everyone needs to feel out of control and have their legs back and be on their back, and the provider's telling them what to do. I don't mean that way of birthing is wrong, but telling everyone that that's the only way they can birth is wrong. The truth is that there are alternative approaches to pushing, and you can learn about all the approaches and then choose the approach that feels most supportive to the way that you want to be supported and the way you want to feel when you're delivering your baby. So we have a lot of research on the difference between the provider touching your baby and your body when the baby comes out, and the provider having their hands off and just letting your baby come out without anyone catching your baby. What we've learned is that the research leans towards provider hands-off being most supportive for decreasing perineal trauma and decreasing the risk for tears. So the way that many OBs are trained currently in this model, every country in the world has a different model. So it's important to know that our way in the US is not the way that it's practiced everywhere, and it's not necessarily the best way. But in the way that most obstetricians work right now, and midwives are a little more of a gray area because nurse midwives tend to practice more hands-on and be a little more medical. Traditional midwives tend to be more hands-off. So just because you have a midwife doesn't mean they're going to practice a certain way. There are obstetricians who do breech births at home. They do home births. So, every provider themselves is different. So it's good to talk to your provider about the way that they approach birth so you guys can have a clear agreement about how you want to be supported. But the idea is that when the baby is coming out, so let's imagine this is baby and the baby's fully at crowning. And when they're at crowning, if my thumb is your perineum, which is that tissue at the bottom of your vagina, if the provider were to be hands-on, they would be protecting your perineum by putting their hand on the perineum as the baby's head is crowning. I've done several years of midwifery training and delivered many babies, and this was the way I was taught as well. I personally didn't align with it. There are some people who it's an option and it's something you can do, and some people find it supportive, but this is it does increase your risk according to the research we have for tearing. So putting their hand there is one thing that they'll do to just offer support. And then, as the baby comes out, their whole head will come out. They'll extend their head up like that. So providers will try to flex the head down. So they might push the head down. And this is also an idea that they have that it'll prevent tearing by flexing the head down. So they put pressure on the perineum, they flex the head down to keep it down, and then the baby will choose which shoulder to deliver first, because the baby is not able to exit the pelvis with both shoulders at their sides, because when they do that, the shoulders get stuck when both shoulders are coming directly out like this. That's not the way that they do it. So instead, when the baby's head comes out, they turn their head, they choose which side they want to turn their head. And when they turn their head, the shoulder follows. And so now the baby is coming out of the pelvis like this. And so their head is turned, and that top shoulder is the shoulder that's going to come out first. So providers will often put their hands on the baby's head. This is also how I was trained. And then it's called downward traction, and they'll pull the baby's head down a little bit, and that clears the top shoulder out of the pubic bone. And once the top shoulder is cleared out of the pubic bone, they'll probably do upward traction to get the bottom shoulder to clear from the sacrum and the tailbone, and then baby will come out. The cool thing is that most of the time, unless there is the shoulders are a little stuck, that's called a shoulder dystocia. That's really rare, but it can happen. Or the baby is in distress and needs to be born faster. Unless one of those circumstances come up where a provider for the safety needs to be hands-on and do hands-on maneuvers to help get baby out faster, hands-on maneuvers are not necessary. They're optional, or something you can absolutely choose if it's supportive to you. All my births, my husband did some of those maneuvers on the baby because I was impatient. My baby's head came out and I was like, let's get him out. He did some of that downward traction. He did a little bit and the baby didn't want to come. So I said, okay, let's wait for the next contraction. Took his hands off and then he put his hands back on and did a little traction. That came from my impatience. It didn't actually improve anything for us, but in the moment, that's what felt supportive for me, was just knowing that someone was there kind of guiding the baby out. But you can deliver your own baby by just keeping your hands there, and your baby will slide out most of the time into your hands. Your partner can deliver your baby by same thing, just baby sliding out into their hands. Or your baby could just be born into the water as long as they're picked up, immediately after they come out. Or they could just come out right onto a bed. No one has to deliver them. No one has to catch your baby or do these maneuvers. If you're on your back in stirrups at the end of a bed where the baby could fall on the ground, then obviously someone needs to catch your baby. If you're standing up, obviously someone needs to catch your baby. If you standing up, you want to catch your own baby, you can stand up and baby can come out and someone could just be behind you to kind of just be there. If baby might fall a little bit in their hands, and they can kind of hand baby to you and you can kind of catch, but it's nice to just have someone else to make sure baby won't land on the ground if you're standing. And if you're in the water in hands and knees, it's nice to have someone behind to catch baby, because if baby flies out into water behind you, if their head comes out of the water and back in, that can be unsafe. So it's good to have someone there to make sure baby's safe and they, come out either above the water or baby stays under the water and they can pass baby between your legs to you. There's a couple different ways that can happen. So those are like some circumstances where it's helpful to have someone catch your baby, but ultimately in most circumstances, it's not necessary. The way really to protect your perineum, and maybe I'm going to backtrack and just share this really quick. There's a great story on Evidence-Based Birth podcast I listened to last night of a woman who gave birth in a hands and knees position. And her obstetrician, she told him in pregnancy, I want to catch my baby, or I want my baby to be born in whatever position is most comfortable for me. I want to choose my position. And he said, yeah, that's great. You can labor in whatever position you want to. And when you're pushing, just get on your back. And she was like, no, you're not understanding me. I want to give birth in whatever position I want. And he was like, well, that makes me uncomfortable. Manage your own feelings, sir. Because I don't know, how am I going to protect your perineum if I don't have a good view? That's what he said. So it's funny how obstetricians claim that they're experts on birth, but some of them, and we have plenty of research on this, do not know how to deliver babies in positions that are upright. Upright positions are so much better for birth, and we're going to talk about that more in step 5. But for so many reasons, but basically there's this idea that I need to protect your perineum to prevent tearing. And the only way that I can do that is with you on your back. But being on your back is the worst position when it comes to increasing your risk for tearing. It's often the least comfortable. If you feel comfortable on your back, that's great. A lot of women don't feel comfortable on their back when they're pushing. And it's not up to your provider to protect your perineum, it's up to you. It's the way that you breathe and the way that you push your baby out is going to be most protective to your perineum. So let's talk about what that looks like. When your baby starts to enter the vaginal canal, most of the time, it is rarely this doesn't happen, but most of the time they put pressure on a pressure point called the Ferguson reflex. This is a part of the female anatomy that was named after a man who said he discovered it. I'm sure that midwives knew about this far before if the Ferguson guy came around, but basically it stimulates something called the fetal ejection reflex, which is where when baby enters the vaginal canal, so let's say you're 10 centimeters dilated and baby starts to enter, they're going to put pressure in the inside of the vaginal wall. They're going to put pressure on this point with their head, and that point, the pressure there, stimulates a reflex for your body to spontaneously push without any conscious effort or control. So just like sneezing or throwing up or anything else that we do biologically that we don't really have a lot of conscious effort or control around, pushing your baby will spontaneously happen most of the time. The only circumstances where it won't happen is if your baby is maybe in a position where they're not putting pressure on that point. This is rare. I've seen it before, only a couple times, so it is pretty rare. Sometimes if the baby is facing forward instead of facing backward, this is called OP positioning, so they're coming out with their face up. See all this space on the back of the head? They might not put the same kind of pressure on the vaginal wall as they would if their face was here, because their face protrudes out in this way that puts this pressure, but the back of the head doesn't. It leaves this extra space. So that can sometimes be a reason why people don't feel the fetal ejection reflex. And oftentimes if they're not feeling it, maybe they're 10 centimeters, they're not feeling the urge to push, just helping them get into different positions and giving them a little bit of guidance. They don't have to like pull their legs back and hold their breath and count to 10 and start doing this directed pushing. Often if you can just support a mom and connecting to her body and like trying to connect with that part of her vagina where the baby is starting to come out. Sometimes providers can put 2 fingers just inside the vagina for a few contractions and give them like a focal point to help them identify where to push. And sometimes doing a little bit of that and adding a little extra force for a few contractions can get baby low enough to kind of start having it kick in on its own. So there are more gentle approaches to pushing that don't involve like holding your breath to the count of 10 and pushing as hard as you can. Another thing that could happen is you feel the urge to push before you're 10 centimeters dilated. This is also super, super rare, but I thought I would just bring it up. And this can just be sometimes because of the position of the baby, where they are in your body. If they're super, super low, and maybe they're in one position where they're leaning one way or the other, that's like putting pressure on a part of your body that's stimulating this feeling like you need to poop. You might start feeling that way, letting in another mama, before you're actually ready to push. I've actually only seen this once in the births that I've attended, but I've heard other stories about it, so that is possible. Some women feel like when they're about to push, they want a cervical exam to see if they're 10 centimeters because they start to feel that pressure, and they just aren't really sure. And that's, a reason why getting a cervical exam can sometimes be helpful. If that's something that would feel supportive to you, to get an exam for someone to say that their baby is low in the pelvis, they're 10 centimeters, and then you'll be like, okay, I'm ready to start pushing. Because I have done cervical exams before and found like they're only 8 and they're feeling the urge to push. So then we would get them into certain positions that can help them dilate and help them resist that urge to push for a few contractions until they dilate the rest of the way. And that usually looks like side lying on the bed with their legs like on some pillows or on a peanut ball. But that is like really rare. Most of the time you will feel that at the perfect time when your body is ready to push. And so I would say that I just want to share like what could possibly happen so you are prepared for that. But in most circumstances, it's totally safe to feel that urge to push spontaneously, which means you're probably feeling like you have to poop. You feel the pressure and your body just goes, your body just like kind of does this spontaneous push. It's safe to surrender to that and to let your body push. So going back to protecting the perineum, when we can say yes to that sensation by softening into it and allowing your body to spontaneously push whenever you start to get that reflex, that is one of the best ways to support your baby in coming through the vaginal canal in a slow and controlled way. So this looks like that, like I said, surrendering and not like adding extra force. So what that means in your body is that instead of engaging your diaphragm consciously, so you're squeezing your tummy muscles to add extra force on top of your uterus contracting, because it's your uterus that contracts that pushes your baby out. So you can have your belly be soft and allow your belly muscles to soften when you feel that urge to push. And you can also help your pelvic floor muscles be soft and for those to soften when you feel the urge to push. So this looks like your body is taking deep breaths and softening in the presence of the pushing sensation instead of your body is tightening and pushing in addition to your uterus contracting and pushing your baby out. This is one of the ways to help the process be slow. So I'm not going to go too deep into the pelvic floor right now, but the pelvic floor, there's a guided meditation in module 1 of the Peaceful Birth Method course, and I recommend that you go check that out. It's like 7 minutes, I think, but that can be really helpful to give you an understanding of what your pelvic floor feels like. When you develop a relationship with your pelvic floor, noticing it as, the top, like by the pubic bone, and I'll show you with the pelvis. It's like, the hammock of muscles that surround your pelvis. So the top of your pelvic floor is 12 o'clock, thinking of it as a clock, and the bottom is 6 o'clock. And if you can look at pelvic floor as this like circle of muscles, this hammock of muscles that need to part kind of out of the way for baby to come through. If you develop a relationship with it and more awareness to it, that can help you in the moment to consciously relax those muscles, because you know what those muscles feel like and you have a relationship with those muscles. So it's not like your whole pelvic floor needs to be tight and you need to do Kegels and strengthen it. And also, you don't have to like do a bunch of perineal massage to like soften it and release tension either. Every person has a different pelvic floor orientation and different tension on different side of the body, and your legs and your back can all connect to your pelvic floor because everything in the body is connected. So, for some people, doing a lot of perineal massage is not very helpful, and for other people, doing a lot of strengthening is not very helpful. So I encourage you to do the meditation, and that kind of might give you a starting point on connecting with your pelvic floor. I'll talk about pelvic floor just a little bit more in a minute. And you can also, if you ever feel like you need more support, you can see a pelvic floor physical therapist for an evaluation, and sometimes that can be helpful as you prepare for birth. It's even more helpful in a second and third pregnancy when you've already had a baby before and the pelvic floor might need a little bit more like attention. So as the baby comes down, you're feeling that fetal ejection reflex. So you're feeling this spontaneous urge to push, and you're feeling more pressure starting to come in your vagina. It kind of feels like you need to take a really big poop, because the baby does put pressure on the rectum as they come down. That doesn't mean you're going to poop. Some people do a little bit and some people don't. Don't worry about it, is what I would say. I would say I haven't seen a lot of poop, honestly. I don't feel like that's very common, because usually your body clears before you go into labor, and before things kind of pick up, there's a lot of clearing. So you feel that pressure, and the baby's starting to enter the vaginal canal. And then the baby does this process that's like this 2-step forward, 1 step back. Maybe I'll actually, if this is like the vaginal opening, if you can imagine like the vaginal opening like this, the baby like comes closer and then goes a little bit back, and then comes closer and then goes a little bit back. And each time there's more opening that's happening and like more stretching that's happening until the baby finally comes all the way to crown. And so this is the biological protection mechanism, I believe, that can help protect your perineum from tearing, because the body has this process where your baby is coming out kind of in the slow way and slowly stretching the tissues more and more and more. So they don't go from, the goal is to not go from like no baby like to crowning all of a sudden, because that's a really big stretch that didn't get any warm up, and that's often when tearing happens from what I see. And so slowing that process down and having your provider not touching, unless you feel like it's necessary or supportive for you, not touching your body or your baby, not stretching your vagina open, not pulling on the baby, not manually turning their head and doing any of this stuff. Most of the time that's not necessary, and all of it can increase the risk for tearing. This idea that you need all these hands up in you and that you can't like deliver your baby on your own is like a total bullshit. And really truly, like, you can be the leader of this process just by listening to your body and allowing your baby to come. As they come, and just trusting that process. You don't have to force it to be faster. You don't have to also tighten up and slow it down. You can just let your baby come in the already like built-in process that's happening, and just let your baby and your body guide the way. When your baby comes to crown, so their head fully fills the vaginal opening, and then on the next contraction, usually their head comes out. What that typically looks like is you'll feel the pressure of your baby's head fully in the vaginal opening. Some people feel what's called the ring of fire, so they'll feel a burning. I did not feel the ring of fire with my second. I did with my third, because he came out in like a push. He just like shot out, and I slowed it down and I didn't tear, but I did feel the ring of fire. And with my third, there was a little more of that 2 steps forward, or my second, that 2 steps forward, 1 step back. So I really didn't feel any pain, and I also didn't tear. And so another way to prevent pain is a warm compress, and I'll talk about that a little bit in a second. But when your baby comes to full crown, I invite you to like hold it as long as you can. And that can feel overwhelming because that's a lot of pressure in the vagina. There can be burning, it can be uncomfortable. It also could not hurt at all, and it could just feel like pressure. And that's how I felt with my second. I was like, there's a lot of pressure happening right now. We're just gonna sit with that for a minute. My husband reminded me to go slow, so I just held it. And I held it for a good 30 seconds and just let my baby stretch for as long as my body was letting my baby stretch. And then as soon as I had another spontaneous contraction, when you're pushing, contractions are really close together. So 30 seconds later, I had another spontaneous push, and I just let that push happen, and then my baby, whoop, their head popped out. Sometimes in the next contraction after crowning, the baby will go from crowning to all the way out, and they'll just come out in one push. Other times, this is more common from what I've seen, baby will be crowning and then they'll go straight out like this, and they'll pause, and there'll be a whole nother contraction. So sometimes there can be a series of 3 contractions to get baby from crowning to out. What's important is that once baby's head is out, that they do come out on the next contraction. If baby does not come out on the next contraction after their full head is out, that is when it's really important to have someone help get baby out. And most of the time they will come out on their own on the next one. And so the baby comes out on the next contraction, and then you can wait. And this is something that, some providers believe that when the head is out, we need to grab the head and pull them out faster. And there are other providers who believe that that is harmful, and there's no need to do that because the biological process of birth is to sometimes have baby's head come out and then the body came out. And all 3 of my births, the head came out and then the body came out, and my babies cried right away, and they were really healthy and happy. Some people say when the baby's head come out, they're not getting any oxygen. They don't get any oxygen when the head is out. I don't know why they say that. I saw a lady talking about that on Instagram the other day, and I was like, that's not true, because the cord is still pulsing and they're still getting oxygen. So it is only if through listening to the baby's heart tones, like your care providers will do during labor, if they notice that the baby's heart tones are dropping and the baby's not doing well, that is a reason why you would want to have someone put their hands on baby and try to get baby out faster. Baby might not tolerate that extra contraction, but that is so, so rare. And so most of the time, if baby's doing well, there is no reason to pull baby out after the head comes out. It's totally safe to just wait for the next contraction. And when the next contraction comes, baby will just on their own choose which shoulder they want to deliver first. So they'll do a little turn to one side or the other. And at this point, it's good when they're doing that turn to have no hands on the baby. Unless OBs manually turn the baby, they also know not to put hands on the baby, and just, it's like a hands off, let baby decide the shoulder. And then, the baby will come out after that. Okay, so do you want to talk about next step? Okay, next step is perineal massage. So the research we have on perineal massage says that it is beneficial for first-time parents to do perineal massage, and that it will decrease the risk for tearing. What we found with second-time parents and beyond is that perineal massage in pregnancy does not impact the rate of tearing, but it does impact or decrease your risk for perineal trauma. So it's possible that doing perineal massage can decrease the rate of episiotomy, and that for both first-time parents and second-time parents and beyond, doing perineal massage in labor decreases the risk for tearing. So I just want to say perineal massage is helpful if it feels welcome to you. It is not helpful, especially in labor, if it doesn't feel welcome to you, because the best way, beyond all these tools, for you to deliver your baby in a way that's protective to your perineum is to breathe slowly, take deep breaths, to listen to your body, to birth intuitively in the position that feels most comfortable for you, and to allow your baby to be born in a slow and controlled way. If you're experiencing something that doesn't make you feel comfortable or safe, that can impact your ability to listen to your body and deliver your baby in a slow way. And if perineal massage feels welcome, that is an evidence-based way that you can decrease your risk for tearing. So in module In the Tear-Free Birth Blueprint, there in the course on our group, there is a lesson on perineal massage. So if you were to go to that lesson, there's a PDF in there that talks more about how to do it. And this week, I'm going to release some videos showing how to do it yourself with like a stool. When you're pregnant, you can do it yourself, or you could have a partner do it. There is not research on this, but a lot of birth workers and childbirth educators talk about the benefit of doing perineal massage to prepare emotionally for the experience of having more intense sensations moving through your body. And also for deepening your intimacy with your partner as you prepare for birth. Perineal massage can be a fun ritual when you like light a candle and like make it all about you. It's not necessarily about pleasure, but it can become about pleasure. But it's like about you and your partner honoring this part of your body and doing something together to prepare your body for the emergence of your baby. And so in addition to perineal massage, sometimes just like doing massage, having partner do like vulva massage and massaging that area of your body with love and with tenderness can feel like really sweet. And also can help you experience a little more pressure and different sensations in that area of your body. And a lot of people say, and I do believe this, that for many, there is benefit to experiencing more pressure and its sensations, practicing that before you give birth to a baby. I had this, I hope this isn't offensive to say, but there's one woman I was supporting, I had the same talk with her in my birth class, and then she came to me to one of my birth classes and she said, Victoria, like my husband and I were doing perineal massage and he got a whole fist in there. And I was like, yay, that's great. That's great. Like if that's something that, putting a hand inside of your vagina, if that feels welcome, if you're curious to explore like what the sensation is of having a lot of pressure in your vagina, do it, And if that doesn't feel like something you want, that's okay too. So it's really just about like what feels good for you and what you kind of want to play with and explore. And it can be fun. And you also don't have to do it if you don't want to do it. So how you do perineal massage is, I'll give you like a quick rundown, but there's a full PDF in the module I talked about. If this is the vaginal opening, this bottom part in my thumbs is the perineum, which is that tissue that runs from the vagina to the rectum. And so if you were to have like fingers go inside, you could do this yourself. If you were to do it yourself, you'd be like standing up probably with your foot on a stool so you can reach because you have a big pregnant belly. And you'd probably want to do it with your thumb. A partner could do it with fingers or thumb, and provider can also do it with fingers or thumb. They might just use fingers and they'll do this. Sometimes with thumbs they'll do this. But basically, so if we go inside the vaginal opening on the perineum, what we do is we just put our thumb or our finger on the very opening of the vagina at the bottom where the perineum is and pull down just a little bit. And give it a little bit of like massage and a little bit of stretching and just maybe hold it for like 10 seconds, 15 seconds, and then do a little more rubbing, and on the other side, hold it for 10 or 15 seconds. And you could just do this for 5 minutes, a couple times a week as you are around 35, 36 weeks and getting closer to your due date. I think the research we have says that doing it for 2 weeks before you go into labor is the most beneficial. So that's something to keep in mind. And I mean, yeah, that's pretty much it. I do want to say I would not use an oil that is not something you would feel safe putting in your mouth if you're going to put it in your vagina. So I would avoid lubricants with parabens and synthetic shit. Just, use like olive oil or what is it? There's this other oil, like a flower oil. I forgot what it is, but it's in the module. Maybe I'll write that up in the notes because it's a good one. I just can't remember at the moment, but there's a few different like natural oils you can try. I would just avoid anything with synthetic fragrances or anything like that. Any questions on perineal massage? Okay, so the next step that I want to talk about is the use of water and warm compresses. So water can be, as we were talking about before with Luna, so helpful for decreasing pain. And we have so much research on the use of hydrotherapy and the use of water birth for not only decreasing tearing, but decreasing the experience of pain and also improving the birth experience as a whole. The research we have on water birth specifically is that water birth not only improves outcomes for moms, so water birth decreases the risk for cesarean, decreases the risk for forceps and vacuum, supports birthing in upright positions, which are more supportive to the perineum, decreases the risk for tearing, and it helps babies have higher APGAR scores at birth. So an APGAR score, it's a score that's given to baby to determine how well they're transitioning after birth, looking at their color and their tone and, like their response to stimulation and things like that, and like when they cry. And so basically babies who are born in the water are scored higher, which means that they're do better after birth. Also, it's noticed in observational studies that babies that are born in water have what parents describe as a more gentle transition into the world. And so the baby may come out of the water, and instead of just crying right away, they might open their eyes and look around and like let out a couple little coughs, and then they'll cry. But they might not like come out crying, and that doesn't mean that there's anything wrong with them. What it usually means is that they're feeling pretty chill about the experience of coming into the world because they're in that warm pool and then they're skin to skin with you. So they're not experiencing that kind of coming out into air and their whole body feeling air, which is a sensation they've never felt before, which can lead to them like crying faster. There's nothing wrong with that, but it is sweet to note that babies born in water are often seen as adjusting to life in a more peaceful way. It is also not necessary for babies to be born crying immediately. We think that like babies need to be like crying right away in order for them to be okay. But there are many different ways to assess a baby after they're born. And what is important is that your baby has strong tone. So they're not floppy, but they like maybe hold their fists, and they might, like if you touch them, they might kind of respond to stimulation, or they have like the strength to them. And then they also are turning pink. As baby circulation system establishes, they will not have a lot of pink in their hands and their feet, but they will have pink on their chest and their belly, and more pink will show up in their extremities over time as they start to assimilate oxygen from the air. So if your baby comes out into the water and they are pink in their body and they have this like strong tone, but they're not crying yet, oftentimes that means that your baby is totally fine and they're just taking a moment to cry, and that's safe in the water and normal. It's like common to see that when they're born in the water. The only risk to water birth is the risk for cord avulsion. And that is when the cord snaps. That has nothing to do with the water, and it has everything to do with the provider and the way that the baby is born. Because if you can't see the cord, you might want to bring the baby up fast, or providers who are not very trained or experienced with water birth can sometimes bring the baby up too fast. The risk is still very low. If the cord snapped, your baby will still be fine. They just need a clamp to go on their side of the cord so that they don't lose blood from their side of the cord. But really it is like, totally like normal for babies to be born like feeling like calm, and for you to bring the baby up to your chest and like intuitively, bring your baby up without it being fast. And it's only kind of in rushed like situations where providers will like throw the baby up super fast and then the cord, can snap. And so that can really easily be prevented. And the other risk is the risk of infection, which happens if you do not use a clean water source or you do not use a clean tub. If your tub is clean and your water source is clean, then that risk is mitigated. So yay, it's very safe. It should be offered everywhere, and it's not, and that's unfortunate, and I hope over time it is offered in more places. So if you are not birthing in the water, what you could do is use a warm compress to protect your perineum. And so this is where you take a washcloth. I would get at home a crock pot set on low with washcloths in it in the room you're giving birth in, or you could bring one of those to the birth center or hospital, or you could ask them to have like a stainless steel bowl with washcloths and hot water, and just to make sure that the washcloth isn't hot when they take it out, And you probably won't want to apply it yourself when you're pushing. You could. Some people push and they hold their hands kind of in that area. Other people like want to focus on what they're doing and they want someone else to apply it. So a partner could apply it. Some doulas apply are willing to do that and some aren't. And then the provider could apply it as well. Having the warm compress there in the second stage of labor, which means when you are pushing, will increase blood flow to the area, which can improve elasticity and the ability to stretch. And so that is how it can support your perineum in protecting it from tearing during birth. But if you're wanting a hands-off birth, I would suggest inviting your provider or your partner to apply the warm compress and to be really clear in your communication with them beforehand that you want the warm compress, but you do not want them to be hands-on when the baby's coming out. So that means when the baby starts to crown, they take their hands off and they remove the warm compress and they don't touch you or your baby. And if you are not sure, you can trust your provider with access to your body and your baby and trusting that they're going to take their hands off. I probably just would avoid doing that at all. And if you can trust your provider, that's great. I really encourage you to, at any point, if you feel like your provider is not going to honor that preference of yours, they're probably not a safe provider for you to birth with. And some people still choose to stay with those kind of providers, and they just know that they might not be able to trust them to do the warm compress, and that's okay too. So it's up to you and what you feel most comfortable with. But if you can find a provider who you feel really safe with and who respects your autonomy, that will really support your birth experience, and it's important. So yeah, warm compresses are also the other way that can decrease pain. So there's a lot of research on warm compresses, and we found that the ring of fire that women talk about, women report experiencing that way less often when they have a warm compress compared to when they don't. Using a warm compress during active labor is not very beneficial. It's something you want to do like right around the time that the baby is coming out. And then being in the birth tub also has the same effect, but what we found is that being on land with the compress is even more effective at like decreasing the risk for tearing and pain, because that warm water is like being pushed like directly on the perineum. But at the same time, being on land, especially in a hospital setting, where there is easier access to your genitals and to your baby, does increase your risk for episiotomy and forceps and vacuum. And being in the water decreases your risk of those things. So there's like this give and take. This is based on studies of other people. It's not about you. So you and your unique situation is going to have a different result. So I just invite you to make choices based on what feels most supportive and most comfortable for you, and not to make choices from like the data or from fear, or from like, I just want to reduce this risk, so I'm going to make this choice to reduce this risk. It's kind of more about, I want to make choices based on what feels most comfortable for me, instead of like what's going to impact risk. When we're focused on risk, sometimes we can end up going down a path that can like lead us to experience what it is that we're wanting to avoid, because we're so focused on that thing that we want to avoid. So instead, I invite you to really focus on what it is that you want to have and what it is you want to experience. Any questions about warm compresses before I move on to the next step? Okay, so the next step is birthing positions. And so there are more video illustrations of this in step 5 of the Tear-Free Birth Blueprint. If you want to look at some videos of pregnant me pretending to give birth in lots of different positions, then those are there. So we have a lot of research on birthing positions and the different positions we can assume to decrease or impact tearing risk. So ultimately, like I said before, choosing the position that's most comfortable for you is the most important. So don't make a choice because the research says this. And at the same time, it's good to be aware of this, because this can help inform you of different positions that can be helpful to try. So what we found is that standing is actually a position that decreases the risk of tearing the most. And lying on your back in a lithotomy position, which is when you're flat on your back. This is very rare. I don't see this anymore. More often women are in reclining positions where they're kind of leaned back, but they're not flat on their back. Being in a lithotomy position is the number one worst position for delivery and impacts tearing risk the most. Being in a reclining position is better, but it does still carry a higher risk for tearing. If you were to give birth in a hands and knees position, in a standing position, or a side lying position, those 3 positions are the most protective for your perineum. And so what that looks like is, first, if you have an epidural, you can be in a side lie position instead of on your back. And if you don't have an epidural, you can also still be in side lie. So this one works for both. Side lie positions looks like you're laying on your side, and then someone will probably help hold that top leg of yours, and they can hold it up for you, or you can like reach down and grab behind your knee, and you can hold it up as well. And then when you're resting, if there is like a few pillows or a peanut ball in between contractions, you could rest that leg on a peanut ball, and that keeps your pelvis open, which is helpful for your baby to come through. And it also allows you to rest because it's hard to hold your leg up, for a long period of time. If you were to be in a side lying position, I encourage you to switch positions every 10 to 15 minutes. And what that does is it creates new little orientations in the pelvis, and that supports your baby in moving through. We have research on dancing in labor, and what we found is that dancing and moving throughout labor decreases labor time. And that's because when we move our pelvis, it creates new little spaces in our pelvis for baby to move through. And so the pelvis has relaxin. There's a hormone you're releasing at the end of pregnancy to help you be more mobile and flexible. So the relaxin can help your pelvis do this and do this and do this. And so when your baby enters your pelvis, they're entering this, it's called the inlet, which is a circle, the first circle that they enter when they start to engage in the pelvis at the end of pregnancy, and they enter like this. And when you're in the beginning of the beginning of labor, you can look in I'll write up the lists of this so you can look later, but in module 4 of the birth class, I'll write this up so you have that. There are certain positions you can do in early labor to open the inlet, so that make your pelvis do this. And when you do this with your pelvis, the baby is able to have more space to engage in the pelvis, and not just to be able to engage, but to engage in a good way, and which means that they're in an optimal position. Their chin is like tucked, and they're in the pelvis in a nice like aligned way. Some babies will have their head not be tucked, the head might be flexed, or they might be like facing forward a little bit, or they might be leaning more on one side or more on the other side. If that happens, it's probably just your baby choosing to adapt to the space that they have. And if we have more tension on one side of our body, that can impact the musculature that surrounds the pelvis and make there be less space in one side of the pelvis. So baby will compensate. But this can lead to a longer labor, a longer pushing phase, and a more painful sensations in labor. So position really is everything. And I'm not going to go too deep into this right now, checking the time. Yeah. But there are 3 positions that you can do, and I'll write this up so you can look at that later in the notes, that I invite you to start doing in your 3rd trimester. And these 3 positions, it takes 5 minutes to do every day. It's called the 3 Sisters of Balance by Spinning Babies. But this helps create evenness and flexibility in the musculature and the ligaments, everything that connects your pelvis together. And that will help your pelvis be more flexible and help for there to be more evenness in all these muscles that surround the pelvis. And so baby has more space to be able to enter. And then baby also has more space at the outlet, which is where the baby leaves the pelvis, to be able to move through. So when you're pushing, to prevent baby from getting kind of like stuck in one position or another, what you can do is change positions frequently. When you are in the pushing phase, well, maybe right before pushing, baby does something called an internal rotation. And so they are facing the side when they go into the pelvis, and then they turn their head like that. Sometimes babies, instead of turning their head straight back, they'll turn their head front, or they'll turn their head front and they'll spin all the way around to back. I don't know why, but that does happen sometimes. And so To give baby all the optimal room that they need to be able to work through, changing positions frequently can be really helpful to help baby navigate. They have to go through all these bony structures. So if you're in like hands and knees positions, that can allow your sacrum to be more flexible and give baby more space to pass your sacrum. If you're in squatting positions that do this, that can allow for more space under your pubic bone for your baby's head to make their way under. And then if you were to do something called an internal rotation, which is where you take your thighs and you point them towards each other. So you point your knees and your toes together in this really kind of funky, interesting position. When you do that internal rotation, and I'll show you guys later, I'll direct you to where to see an example of that. What it does is it takes the outlet of the pelvis and it brings it like this. So now all of a sudden your baby had this space to exit your pelvis, and now they have this. So they have way more space to exit. And so this is something that you can incorporate into any of the positions you're doing. If you're lying on your side, you can just hold your leg up but turn your knee inward a little bit. And now there's a little bit of that internal rotation. If you're in your hands and knees, you can point your knees towards each other. And now there's that internal rotation. You can push like that. If you're standing and maybe you have some contractions and you're pushing with your legs kind of like your knees pointed outward and a little bit of a squat, you can then do a couple contractions with your knees pointed inward together and do some pushing like that. And so offering every couple contractions a little change in orientation of the pelvis can help labor or can help the pushing phase be more effective and to go faster. We don't want, obviously, like I said before, for baby to just like rush out, but it's rare that baby comes out in 2 contractions. There's usually 30 minutes to an hour, sometimes a little more of pushing. So especially if pushing is long, if it's taking over an hour, doing these frequent changes in positions can really help, because if it's taking a while, it's probably just because baby is having a hard time exiting the pelvis and they just need support with adding a little more space. One more thing you can try is adding the internal rotation to the positions we talked about, right? Which is like the hands and knees, side lying, and standing. That doesn't mean you can't do squatting or you can't do like lunging or kneeling. You could do that as well. I delivered all 3 of my babies in a runner's lunge. That was like the position I wanted to be in. But, so you can add that internal rotation. Another thing you can add is asymmetry. So if you take a pillow or a yoga block, let's say you're in hands and knees. Once again, there's video demonstrations of this I'll guide you to. You can put your knee on a yoga block and push like that. And now all of a sudden you took your pelvis and you brought it from here to here. You opened, maybe I'll show you like this, here to here. So you open this one side of the pelvis by lifting your leg up. Or if you're standing up, you can get a chair and put your leg up on a chair. And now all of a sudden your pelvis is like that again, because your hip and your leg are moved out of the way. And if your baby is a little stuck on the side, now they have all this more space. And sometimes it's just that little shift that really does it, that will help baby come through. The same thing happens if like the baby is a little stuck in the pelvis. This is so rare. I mentioned this to Luna, but for those who came later, it's called a shoulder dystocia. It's very, very rare. But if a baby's head comes out and their shoulders get a little stuck, this is one of the rare circumstances where having a provider be hands-on is helpful. That doesn't mean they have to be hands-on to identify it. If they can just witness and be hands-off, and if they notice something's happening, then they can step in. If you were to lift a leg up, sometimes that is all that needs to happen to resolve it. Or if you were to get into hands and knees, sometimes that's all that needs to happen to resolve it. Often it is. And it is even more rare that someone needs to put their fingers in your vagina and try to get the shoulder to clear to resolve a dystocia. Most of the time it just takes the provider doing some of that traction to clear that top bone while you are either lifting your leg into like a lunge in hands and knees, maybe making it a hands and knees with a lunge, or getting into a hands and knees position to start with, or if you're standing, like lifting your leg up on a chair or something like that. So there is so much power to position. But like I said before, ultimately getting in the position that feels the most comfortable for you and allows you to not push baby out super fast, but allows you to surrender and to let your baby's head fill the vaginal opening and to just hold it and to be supported in holding it is really the best way that you can decrease the risk for tearing. A lot of people talk about like breath work, like do these specific breathing techniques. I don't personally find a lot of benefit from breathing techniques with the clients I've worked with and with my own births. But that's just me, and I'm sure there's a lot of benefit that others find from it. What I found is most helpful is that when you're panting and breathing really fast, I don't know if you've seen that, like, it's my water bottle. If you've seen that, like, right, like in movies, people like panting. The idea is that if you're panting, you're not going to add extra force to the pressure of your baby's head coming out. You can try that if that feels helpful for you. I personally believe that if you do a lot of panting, you're going to run out of oxygen, and it's better to maintain good oxygen levels for you and your baby. When your oxygen is low, baby's oxygen is low. And so that means that impacts your baby's heart rate and their ability to tolerate labor well, tolerate pushing well. So you taking deep, slow breaths and giving yourself all the oxygen and resources that you need to go slow through your breath and giving baby the oxygen they need to continue to tolerate the process well, I believe is more helpful. So that really just looks like breathing in a way that allows you to soften your pelvic floor muscles, soften your belly. And I just imagine breathing slow, taking like slow breaths. And then as you exhale, you soften your body even more. And softening your body means that you're intentionally relaxing your muscles and you're not tightening or adding extra force. So it's just these like deep breaths. You can do in the nose and out the mouth if you want to. I really just like believe that instead of telling people like do the specific counting technique or this specific breathing technique, it really just whatever can help you breathe slow and give your baby oxygen is most helpful. And that is my 5-step process. And I hope this is helpful. Like I said at the beginning, this isn't like a magic pill. Following all these steps doesn't mean that you won't tear, but it will definitely dramatically decrease your risk for tearing. And it's up to you to implement them. And I'm here to support you. If you want to come to the Q&A calls and you have like every week at this time, if you have questions, I want me to go over anything again, I'm here for you. If you want to post in the group with a question or message me, I'm here for you. I'd really love to continue to support you throughout this process. And I'm really honored that you all chose to spend like time out of your day to listen to me talk. And I envision all of you having like really beautiful and empowering birth experiences. And you've got this.